Welcome to Not Milk Never Milk. Subscribe if you're lactose intolerant.
You start by getting everything reachable: fresh diaper, wipes, gloves, barrier cream, waterproof pad, and a disposal bag. Once you have supplies, make sure the bed or chair is secure and wheels locked. Privacy and lighting matter for dignity and safety. You position the person supine or side-lying depending on mobility, supporting joints, and using pillows to prevent strain. This reduces transfers and lets you access the area safely while keeping the person comfortable and stable. You unfasten tabs carefully and roll the used diaper inward, placing it under the person to contain mess. This keeps the clean surface ready. Then, clean the skin front to back with soft wipes, changing wipes frequently to avoid cross-contamination, and pat the area dry since moisture promotes irritation. Once dry, inspect skin for redness, rashes, or breakdown so you can treat early. If the skin is intact, apply a thin layer of barrier cream to protect against moisture and friction before the clean diaper goes on. You center the clean diaper under the person, pull front up evenly, and fasten tabs snugly, tight enough to prevent leaks but loose enough for comfort and 2 fingers of breathability. Once secured, smooth wrinkles to reduce pressure points and reposition clothing. If they can sit, help them up slowly to avoid dizziness. Dispose of the soiled diaper and wipes in a sealed bag and wash your hands. If a leak, rash, or unusual odor appears, reassess fit, skin condition, and consult caregiving notes or a clinician as needed.
Thanks for watching. If this was helpful, leave a like and consider subscribing. See you next time.